Hey, welcome everyone. Welcome to Mindful Nurses. It's great to have you guys coming back. This is our Wellness Wednesday event, and we're hosting these events every Wednesday to support nurses' mental health and well-being through various mindfulness, holistic wellness, and self-care practices. And today we're super excited to have a session from Devon Grimes about psychedelics and nursing, healing from within. And this is really exciting for us. For me personally, I know that plant medicine and psychedelics has been a big part of my personal healing journey and raising my own awareness and connection to myself. So I'm really excited to see how this field is merging with nursing and to see nurses getting involved with this aspect of healing. So we're really happy to have you with us today, Devon. I'll turn it over to you. Thanks for coming.
Yeah, oh my God, thank you so much for having me. Oh, I hear myself echoing just a little bit. Sorry. Um, Let me get my presentation going, but that's so exciting that it's been a big part of your journey. I wasn't aware of that. That's amazing.
Yeah, it's
Let
really nice to meet you. I'm looking forward to sharing more with each other about our journeys with.
Absolutely. All right, let me screen share here. Okay. Can you see everything all right?
Yeah, let's see. Yeah.
Let me see if I can get in full screen mode here. How about there? There we go. Is it full
Yeah,
screen now?
full screen looks great.
Amazing. So I kind of changed the title just a little bit because we're going to be focusing a lot on trusting the inner healer, but it's the same presentation. It's the same concept. So my name is Devon Grimm, and I am an RN BSN. And I'll give you just a little introduction about me as we start. So I have a little over a decade experience as an RN. Most of my background has actually been in the neonatal ICU, but I've done a lot of charge nurse roles, home health, case management, and specialty pediatric practice. Right now, I'm in the Inca International Nurse Coach Academy, and I'm in my practicum to become board certified as an integrative nurse coach, which I think really aligns with work with plant medicines and integration, especially. I'm the Michigan representative for the International Association of Psychedelic Nurses, which we'll talk about a little bit later. And I'll be a participant in the very first Hope Health Network RN training in May. So that is with medical cannabis and psilocybin in Jamaica. So I'm really looking forward to that. I am actually proud to say, too, I just got the word that I will be in the inaugural cohort of the Fireside Project, which is a 24/7 free peer support psychedelic hotline, which is actually affiliated now with MAPS and the Zendo Project. So I couldn't be more thrilled to be involved with that and repping nurses. I'm a member of the Holistic Nursing Association, the Cannabis Nursing Association, Cannabis Nursing Network, and the Plant Medicine Association. So I'm really trying to spread my branches out to a lot of different places. I'm in the Psychedelics Today integration peer consult group that's going through June, so learning a lot from there as well. And then just a little bit about me, I'm a lover of stand-up comedy, synthwave and funk music, plant-based living, and actually death positivity. So that's a big part of my journey. The legal stuff, since we are talking about psychedelics, I just want to make it very clear that we are not promoting the use of any illegal substances right now. We are not sharing information on obtaining any substances or sourcing in any way. This is just a discussion of nursing theory, education, harm reduction regarding plant medicines, and this should not be considered medical advice. We're having a talk today. And then I don't think any talk about plant medicines could be complete without recognizing the indigenous people that came before us. As we go into this space, nurses getting into psychedelics, we need to remember that we should be partnering and giving back to indigenous communities that have kept knowledge and practices of plant medicines alive for literally thousands of years. They're not something that's new, they're just relatively newer to Western medicine. So we owe much of the success and where we are now to the indigenous people that have kept this knowledge alive. So as far as current legal status here in the US, when we're talking about plant medicines, some people may already know about the decriminalized nature movement. It's going all across the US and they're wonderful. They have written policies to get all entheogenic plants decriminalized in certain cities. The whole state of Oregon is actually participating in this. Oakland and Santa Cruz, California, Denver, local here to me, Ann Arbor, Washington, D.C., and even Canada has some legalized psilocybin therapy now in certain cases. Obviously, there's other parts of the world where plant medicines are already totally legal. And hopefully, here in the US, we may see federally legalized cannabis this year. That's been something that's been talked about already a couple times. So I thought, coming from nurse coaching, a big part of nurse coaching is doing awareness practices. So I figured we might take a moment, and I need it too, just to have a little bit of an awareness grounding practice based on one of my personal inspirations, Mr. Ram Dass, who wrote a book back in the 70s. That's the cover of it right there, called Be Here Now. So if everybody watching wants to join in, I would love that very much. But let's just kind of cozy into our computer chairs or wherever we might be and just start connecting with our breath just for a couple of moments, just to ground. And I want to thank you so much for being here with me today. Hopefully, you'll gain a little bit of insight, and I'll have a lot of fun sharing it with you. For now, let's just kind of connect with our breath just for a moment. And as we sit here and we connect with our breath, thoughts are going to come. Try your best to acknowledge them and let them go. Flex that mindfulness muscle. Just stay with your breath. There's nowhere else to go. We're just going to be here now. Try not to anticipate. Just ground yourself in this moment for a few more breaths. And then when we're ready, slowly open our eyes back up and come back to the room. Hopefully now we're nice and grounded and ready to spend a little bit of time together. Okay. So opening with what I feel is the thread that binds us being nurses and then people in the psychedelic space. So, nurse coaching and holistic nursing in general, I believe, align with expanded state of consciousness healing, and that it relies on a belief in everybody's inner wisdom and everybody's inner healer, and that is regardless of any other factors. Even though plant medicines can be life changing, can produce these profound experiences, really the key to sustained change and healing relies on the concept of integration. So, using the insights or the lessons learned through expanded consciousness and incorporating them, hopefully meaningfully, into your everyday life. So, I believe that psychedelic therapy is a paradigm shift in modern medicine, and that nurse coaching is a paradigm shift in modern nursing. And what I mean by that is that nurse coaching is refocusing the power on the client rather than on the practitioner. We're kind of giving people permission to be their own healers. When before we've really been in this medical paradigm where people are really relying on their doctors to heal them, and not realizing that the potential is there all the time. Um, and then as far as psychedelics being a paradigm shift, it's very similar in that we are taking the lens of focus off of just diagnoses and symptoms and kind of placing it on the root cause of, suffering or whatever's going on, and taking a more active approach in our healing, and not just sometimes blunting things or covering them up. I put this slide in here because I really like to promote The Way of the Psychonaut is a really good movie. It stars Stanislav Grof, who is one of the OG psychotherapists back from the 60s that did a lot of research. And then after they became illegal, he actually is the creator of holotropic breath work, which he used as a way to get people into expanded consciousness states without the use of any psychoactive substance. So really cool. If you have the chance to watch that movie, I highly recommend it. And he has a really relevant quote here that I love, that psychedelics used responsibly with proper caution, would be for psychiatry what the microscope is for biology and what the telescope is for astronomy. And I think that is a really accurate and cool quote. Oop, there we go. So, what is a nurse coach? I just want to spend a little time on nurse coaching in particular because number one, I'm becoming a nurse coach right now, but also because it's still kind of in its infancy. And I feel like the word isn't quite out there yet for knowing what nurse coaching really means. So, nurse coaches, rooted in holistic theory, integrative worldviews, the most important thing is that the healing of the client is always at the center of everything we do. We're taking scientifically proven coaching concepts and we're applying them to basically any nursing practice. So, yes, you can become a private nurse coach where what you're doing is mainly coaching with people, but you can also be a floor nurse that's a nurse coach, or in this case, a mental health nurse that's also a nurse coach, and take a lot of these concepts and use them in pretty much any setting. Um, Sessions are skilled, they're purposeful, they're results oriented. And then you can see down here below, I talk about some of the modalities that we use to, do these coaching sessions: empathy, nonviolent communication, which I really resonate with. If people haven't heard of that before, I highly recommend looking it up. It is not just a communication skill to me, but almost an entire way of living your life. It's awesome. Deep listening and space holding, which is paramount, motivational interviewing and appreciative inquiry. That's kind of basic coaching concepts. And then each nurse coach is going to bring their own uniqueness into their coaching. So there's a lot of nurse coaches that are Reiki masters. There's a lot of yogis. There's a lot of breathwork practitioners. And it's basically a way that nurses can kind of take some of that ownership back and really be practitioners without having, doctors having to oversight everything we do. Nurse coaches can have private practice, which I think is really cool. We're meeting clients where they're at, and we're helping to cultivate and nurture self efficacy and trust in the client's own inner wisdom. Whoop, there we go. So this is just really brief. I just wanted to show if you were interested in becoming a nurse coach, this is what you have to do. You do have to have your bachelor's. You do have to be a nurse for 2 years, and then you do have to have 60 hours of coaching experience. But most nurse coaching training programs will give you that experience, and then you can take your boards afterwards. And if you don't have your bachelor's or you're just not interested in coaching, you can also just become board certified as a holistic nurse. And that is open to any nurse, little less restrictive on what you need, only 2,000 hours or a year of full-time nursing practice, and then some general education hours in holistic nursing. So just put it out there for people that might not know. So I love this slide. This one is probably my favorite in the whole thing. So getting into nurse coaching and holistic nursing has really helped me to kind of acknowledge and embrace some of my own strengths and what energizes me in my own life. That's why I'm here right now. So I think nurses are held to really high standards. And sometimes we put others above ourselves in the name of service, and we end up burning out sometimes. Some nurses end up eating their young when you're training people, and we might even sometimes forget why we became a nurse in the first place. We get lost in the time crunch and we lose some of that deep, authentic healing connection, which maybe is why we got here in the first place, and then we wonder what we're doing. So humans are meaning makers, and when we lose meaning, we lose hope. And for me, I can't think of something more meaningful than being recognized for my authenticity and being encouraged, not only for the things I do well, but sometimes for the things I don't do well, just because that's me as a whole person. And this has really helped me kind of accept that. So I just wanted to spend a moment there. So now we're getting into more psychedelic stuff. So hopefully piquing everybody's interest. So nurses as psychedelic advocates. I think it's really cool to say that for 18 years in a row, nurses have been rated as the most trust, honesty, and ethics of any other profession in the US. And it's not just in the US. The UK shows similar statistics, and a lot of other countries that I've looked at when they poll people. So I think if we kind of wield the honor of this trust and direct it into research and positive messages regarding plant medicine, that this really could be something that shifts the tide overall in how society views them, and destigmatizing and really helping this get out to people to heal them. So Continuing as psychedelic advocates, nurse actions are performed for a desire to do good freely and to contribute to unity, not performed for the sake of social norms. So, inherent in nursing itself is the respect for life, dignity, autonomy, and the rights of all human beings. And, a relationship with a nurse or any trusted practitioner is an opportunity to add a deeper level for healing and for transformation in a client who's going on this journey. Having this support person who nurses already have this trust, we can be trained in all these different modalities. I think it can be such a support for people, excuse me. And I see a continued future for nurses, not just at the bedside during psychedelic therapy sessions, but also in a wide variety of other roles. And we'll kind of go over that because I do talk about some nurses who are already in this space doing a bunch of different things. Um, but I think nurses are needed even on the level of ethics. I just heard the other day about a company called Compass Pathways trying to put a patent on hand holding and soft furniture for psychedelic therapy. And I just think that putting nurses in this space might help to keep some of the ethics up and help us remember that it's always community over competition and that people healing is what we should be focusing and not where the money is going to be made and putting patents out. So here are some of my idols in the nursing space right now. We have got a lot of different roles that nurses are playing with psychedelics. So over on the left, you have Taylor Hayes. She founded the International Association of Psychedelic Nurses, the Hope Health Network, facilitator training. You've got Karen Cooper there in the middle. She is actually on staff at the California Institute of Integral Studies in their psychedelic therapy certificate program. And she has managed several MAP studies, which I think is really cool for MDMA. Then you've got Angela Ward. She's over on the right. She is actually a nurse coach and doing work with integration. So I'm hoping to kind of follow in her footsteps a little bit. And she is one of the founding members of a group called Open Nurses, which is another entheogenic friendly nursing association, which we'll talk about too. They're great. Down at the bottom, you see that book cover for DMT, the spirit molecule. There is a nurse in that book, Laura Berg. And she was not only a guide, but a research nurse for the very first clinical DMT trials in the United States. That book is great. We talk about it a little more later. And then down at the bottom on the right is Andrew Penn. And he's not only a psychiatric mental health nurse practitioner, but he's a professor at UC San Francisco, and he's a psychedelic psychotherapy researcher. So just on this one page, we see 5 nurses who all have such, different ways that they've gotten into this space. And I think that's really cool. So a brief introduction to psychedelics themselves, just in case people are a little unfamiliar. So the word itself comes from 2 different Greek words, psyche meaning mind and delos meaning revealing. But you may have heard me already say entheogen a couple times already. So it's a newer term and it kind of lets go of that 60s stigma that goes with the word psychedelic. And it refers a little more to using plant medicines in a sacramental or, a sacred context, that which causes God to be known or experienced within an individual. So that is kind of the term a lot of people are trying to pick up. Most psychedelics that we're studying right now today in the US are natural. They've been used as sacraments for very long amounts of time. When I'm talking about long amounts of time, ayahuasca has been used dating back at least 1,000 years. There are archaeologists who see psychedelic themed mushroom illustrations that go back to 10,000 BCE. So we're talking about ancient uses as sacraments for most of these substances. The major synthetic psychedelic ketamine has well over 1,000 completed scientific studies. So it's very well researched. We know a lot about it. Psychedelics in general have minimal contraindications or side effects. Now, there are some. There's some cardiac conditions that are considered contraindications to a psychedelic experience, and there are some mental health conditions that also are considered contraindications at this time, but they are minimal. Illegal status is highly tied with political and social issues right now, not necessarily with safety or efficacy. If anything, psychedelics have anti addictive properties, which we will touch on. But despite all the research, they're still listed as Schedule 1 substances at this time. I think society is starting to shift a little in how we feel about this. And hopefully we're starting to recognize that the war on drugs has really been a detriment to a lot of communities. And hopefully nurses can really lead in changing perspective of this overall. So how do they work? So I put this little picture over here that can kind of show you some of the increased brain activity. I believe this one is from LSD, right? My little icon is over it. Yes. So psychedelics place amplification on our often deep and meaningful inner thoughts and emotions. And during these experiences, we have new pathways that become available in the mind. This can allow us to reframe past experiences or even aspects of the self. Re-experiencing things, even things that are greatly traumatic, can sometimes change perspective, reframe things, and change its overall meaning. And when you change something's meaning, I mean, that's profound a lot of times. Rapid onset of effect with most psychedelic substances, potentially life changing results, even in older adults who are known to be more resistant to change. There is a window of neuroplasticity that's open after a lot of psychedelic experiences, and there's actually promotion of the production of BDNF, which is brain derived nootropic factor, that is involved in plastic changes of the brain with memory and learning. So cool that that is perpetuated by psychedelic experiences. Um, Decreases default mode network activity. So the default mode network is a part of your brain where the ego is thought to live. So when we decrease activity there, it kind of makes sense that we have these ego dissolving, um, you know, experiences of transcendence and oneness. We think that that might be really where that stems from. So psychedelics are consumed not just for healing in the medical sense, like we're really talking about it here in the US, treating depression, treating anxiety, but also in a lot of cultures for spiritual experience, and sacred inner work. So there are multiple reasons that people can use these substances. Let me make sure. There we go. So current therapy, and when I'm talking about current therapy, I'm kind of focusing here on like SSRIs and current antidepressant therapy because that's what a lot of the research is here in the US. So a lot of our current treatment for depression and anxiety and addiction focuses on suppression and not necessarily the root cause of what's causing the issue in the first place. We're taking kind of a passive approach and we're relying on the drug and not the person. Chemical changes are perceived as the problem, and there's a lot of risk of side effects. So I've included this little drawing on the side that shows you a couple of the side effects people can deal with long-term SSRI use. But I mean, it's a big problem. Depression is the number one disability worldwide, and it affects more women and minority groups. I feel like the conversation is opening a little bit more, but really, for as predominant as depression is, I think we need to take treatment more seriously. Psychedelics, I also want to note, have shown a lot of promise in death and end of life anxiety, which I think is an area that we really neglect here in the US. Death seems to be kind of a dirty word, and we don't want to talk about it, but that's one of my advocacy missions to really talk about death positivity as well as psychedelic substances. So, this right here is a picture of kind of the typical Western setup for a psychedelic therapy session. You're in sometimes a hospital and they've kind of revamped the room, but they've tried to make a clean, safe environment with minimal distractions. Usually that there's been some psychotherapy done where they've prepared the client for the session. They hopefully have an intention set. Hopefully they're in a good mindset where they can surrender to the experience and kind of be a little more open to whatever it presents to them at the time. There's usually a blindfold on, there's usually headphones and a standardized playlist. I think you can get the one that they use at St. John's Hopkins on Spotify. There's a playlist available, but the more unfamiliar the music, actually, the better it's shown to produce an experience. So I thought that was kind of cool. A lot of times they'll have books and artwork and things for people to look at. And usually there are two trained guides or therapists. Now, the way that they used to do this was made in the 60s, and it's definitely pretty antiquated now. They wanted to always have a man and a woman, kind of to have these archetypes. And also, it was the 60s, and that's just the way they wanted it. But we need to remember, obviously, there's non-binary, transgendered, and non-traditional members that we want to be in the healing team. So it's not about having a male and a female. It's really about what is going to work best for the client. Um, Two guides are also good from a nurse's perspective too, because you can debrief after a session. Those two people, if they work together all the time, can become a better team and really, develop an even more powerful healing dynamic. When we're talking about psychedelics outside of the US, a lot of times we're taking them in ceremonial or outdoor areas, which is great. I wish we had a little bit more of that here, but really it's what makes the client comfortable. Some people are a little more comfortable being in a container and being inside. Some people like to be outdoors in the nature and feeling that connectedness. We got to ask, what do people want? So here's a slide with a couple of movies that I highly recommend that are in this space. So on the left-hand side there, we have a movie called From Shock to Awe. It's really great. It focuses on some veterans, I believe, from the Iraq War that are suffering from PTSD, and they go to an ayahuasca retreat. And it's beautiful, the transition that these people make. I can't recommend this movie highly enough. If you can see it, please do. That's a quote right there from one of the veterans in the movies or in the movie. And then on the right hand side is a psilocybin movie where it focuses on a lot of the patients that have been in end of life cancer trials and use psilocybin. There's a quote there from Annie Levy, who is a neuropsychologist and one of the cancer trial participants. She has since passed away, but she is a big part of that movie, and everything she has to say is just beautiful. If you really want to see how much these medicines are healing people, I think these are two really great ways to start and really easy. I think they're only about an hour, hour and a half each. So I just wanted to touch base on four of the kind of main substances, at least as far as research in the US goes. So the first one, probably people know the most of, psilocybin, people call them magic mushrooms, naturally occurs in over 200 mushrooms that we know of. Effects last about 6 to 8 hours. It breaks down to psilocin within the body. And like I've said before, it's been used for a very long time within indigenous cultures. It affects serotonin receptors in the brain, which produces the experience. If you look down, and I know everybody might have already seen this picture, but it's just so cool, that's showing the connections that are made during a psilocybin experience. The circle that's on the left hand side where you only see, more sparse amounts of connections, that's the pre-psilocybin brain. And then over to the right, you can see just the amazing amounts of new connections that are being made during the experience. So psilocybin has been proven in promoting smoking cessation and treatment resistant depression. It's FDA breakthrough status for that, reducing end of life anxiety, and the last one is actually the coolest to me. Psilocybin producing lasting changes in attitudes and beliefs about nature and decreased authoritarian political views, which I think is such a cool study. Down at the very bottom on the left, you can see a 6-month follow-up from psilocybin treatment. I think this one is from the Beckley Institute, but shows you that even 6 months later, people are having still profound changes in healing from their psilocybin experience, which is awesome. Next, we've got ayahuasca. So people may already kind of know a bit about ayahuasca too. It's native to the Amazon in South America, and it contains two different ingredients. So it's got part of a vine and it's got leaves. And it's so amazing to me that somebody 1,000 years ago, knew to combine these two ingredients to make this substance. Like, how amazing is that? The active ingredient is DMT, which people might already know outside of ayahuasca. So it's made into this viscous brew. You take it in a hopefully ceremonial context, and then there usually is purging involved, so throwing up, other ways of purging. But a lot of time, well, most of the time, the purging is seen as part of the process. Getting out some of the negative energy or getting ready for hopefully a profound experience. The purging is part of it. So ayahuasca is known to produce really profound, visionary experiences, detachment, possible ego dissolution. And you can see some of the researched effects there are really cool. Rapid antidepressant, clarity about life purpose, beneficial role in overcoming trauma, PTSD, drug addictions, and even stimulation of neurogenesis. And there's a lot of really cool new studies going on that are looking at that aspect, the neurogenesis aspect for stroke victims, actually, right now. There's a study that's going to start. Next up, we have MDMA, which I'll just touch on a little bit, but MAPS, which is the biggest organization doing psychedelic research, has really made huge headway in MDMA. It's looking like it's going to be FDA approved as a prescription treatment by 2023 for PTSD, which is amazing. So it was used back in the 70s for psychotherapy and couples therapy. It increases serotonin, dopamine, norepinephrine in the brain, and it decreases activity in the amygdala, which is the fear center of the brain and usually where our fight or flight response resides. So we're decreasing some of that activity and we're kind of opening up to empathy. We're opening up to, let me move my screen here so I can see my slide a little better. Um, let's see. I know. Let's see. Recently completed. Oh yeah, there is a study going on with MDMA assisted therapy for autistic adults with social anxiety, which I think is really awesome. Some research effects. We have breakthrough status again for PTSD, reduction in social anxiety. Oh, with autism, and then currently under investigation for alcohol use disorder. But this picture down at the bottom, I just wanted to highlight that real quick, where it's that circle going around. So that was looking at people after having treatment for PTSD with MDMA, and you can see the light blue line that's in the middle. That was people who still qualified for having PTSD after treatment of normal just psychotherapy without anything else. And you can see about 80% of people still qualified as having PTSD. And then that orange bar are the people that did get the MDMA assisted psychotherapy. And you can see it's well below 25%. So, I mean, what a huge difference in the two treatment modalities. So, I think that really says something right there. Let's move on to the next one here, ketamine. Um, so ketamine, like I said a little bit earlier, is the number one synthetic psychoactive substance that we're really talking about here in the US. It was initially developed as an anesthetic, and there are IV ketamine clinics that are open in the US right now, treating for depression and addiction. The problem is it's still very expensive. It is not FDA approved for mood disorder use, so insurance companies will not pay for it right now, which is why ketamine therapy remains so expensive. There is some hope because they've developed a nasal spray now. It's FDA approved for treatment of treatment resistant depression, but it does require medical monitoring by a doctor, and it does have to be in conjunction with an oral antidepressant. So I'm not exactly sure where that's going, but the nasal spray does last a lot longer than IV ketamine, lasts up to 30 days versus IV ketamine. Usually after a week or so, the effects start to kind of resolve. But the success rate is nearly double traditional antidepressants. You're looking at 85% success rate with ketamine versus 45% with your SSRIs. Rapid resolution of suicidal ideation, rapid antidepressant effects. So really fast acting, but not necessarily very long lasting. So, with all that we kind of talked about with these substances and all the wonderful things they can do, we still have to remember that the most important aspect is the work that comes after the experience. So, the integration and the implementation. There's more healing work to be done. I put that little picture on the right. That is an integration workbook that I do believe is available for free from Psychedelics today. I think you can go to their website and download it, and it's a really great resource for those that don't have anything like that. So back to nursing again for a little bit. So kind of connecting the pieces together. Nurse coaches and holistic nurses are specifically trained and encouraged to grow understanding regarding the following. And I think all of these are really helpful when we're talking about working with people with expanded states of consciousness or working, to integrate these experiences. So transpersonal concepts, interconnectedness and energy field dynamics, having an integral worldview for, intangible awareness related factors, not just for ourselves, but globally, we are trying to really promote that we are an instrument of healing, the nurse themselves. We don't just see treatments, we see that being seen and heard can be medicine in itself, that us providing that to somebody is medicine. We're trying to promote that preventative health teaching, mindfulness, stress reduction, connecting to inner knowing can be its own field of nursing medicine. And we're honoring and emphasizing each person's uniqueness. And once again, coming back to trusting that inner wisdom that is capable of healing you at any time if you allow it to be expressed and you nurture it. Now, when I say transpersonal, I just want to reiterate. So the transpersonal just really means the concept of areas of consciousness that are beyond personal identity. So this is a debate, but I kind of think that it's invaluable if you're going to be doing this sort of work that really, you should kind of know what an expanded state of consciousness is like to be able to work with people. Quite frequently, people are dealing with experiences that are more mystical in nature. It can be hard to constrain these type of experiences with words. They can be ineffable, is what people often say. So, it can be literally impossible to describe sometimes. A practitioner having firsthand knowledge of this is a tool to help journeyers really feel seen and heard. I wanted to share this quote because I think it's kind of relevant here. So it's from a book called The Five Invitations. It's written by Frank Ostasecki. He was actually friends with Ram Dass. He does a lot of death positivity and hospice work. But I think it's really relevant. So professional warmth doesn't heal. It's not our expertise, but the exploration of our own suffering that enables us to be of real assistance. That's what allows us to touch another human being's pain with compassion instead of with fear and pity. We have to invite everything in. So we can't travel with others into territory we haven't explored ourselves. It's the exploration of our inner life that enables us to form an empathetic bridge to another person. I think that quote is beautiful and it has stuck with me. It reminds me that we can only take people as far as we've gone. If we want to work towards the betterment and the healing of other people, then we have to constantly be working towards the betterment and the healing of ourselves. um and I feel as nurses we should rock that and know that all the time, but in modern nursing and hospitals sometimes we forget about that. So nurse coaching process, we'll hit on this just for a minute. At the center of every interaction in nursing and nurse coaching is the healing of the client. So our ability to form a foundation of trust, openness, non-judgment can be, it can't be overstated forming this bond with a client. Trust allows the chance of surrender. And if somebody's in a place where they're willing to surrender and be open to experience, this is proven to lead to a more, gentle or healing experience, usually with a psychedelic substance. So, the prep for integration of an experience or doing what people call shadow work, or kind of looking at some of the more unloved aspects of yourself, I think can be well suited to nurses, especially ones who have been trained as coaches. We have a strong foundation, I think, too, to be trained as guides for sessions. Obviously, still, I think there's a huge place for psychotherapists, but in a two-person model, I think nurses would fit perfectly to be one of those two people actually guiding a session. Connecting again with the inner healer and my friend Ram Dass again on the side. As nurses and especially as nurse coaches, we're walking with clients in self-discovery. I didn't really hit too that I use the word client in this all the time, and that in itself I think is a paradigm shift. I don't like to call people patients. Trying to stay on that level of peer level, even though I have the education and I have initials after my name. We're all walking each other home. We are all on an equal playing field. So nurse coaches guide the transforming self, but still recognize everybody's already whole. And healing is a lifelong process. So we can help with that, but we need to remember that all the time. A shift in one's consciousness, and this is a client or the nurse themselves, allows for a shift in one's capacity to be able to transform suffering and find new truth and meaning. And then that little picture over there, all that you seek is already within you. And if you're in the psychedelic space, you might already be familiar with Maria Sabina and her, the medicine is within you quote too, very similar. There we go. So this I realize this picture over here is a little overwhelming. There is a lot going on. But I just really wanted to put it in here because I think it helps to show that nurse coaches and holistic nurses, and usually just nurses in general, we're recognizing all aspects of the human experience. And this can help shift our consciousness into deeper levels of everything, our knowing, our doing, our being. We're recognizing that healing is not synonymous with curing necessarily, and healing can occur until the very moment of death. Like I've said before, but it can't be said enough, being truly heard and seen is powerful medicine, and we are ready to give that at any time. Self reflection leads to deeper understanding for change, and it greatly increases our capacity for healing of ourselves and others. So looking at that picture again on the side, I just want to see, you can see at the center of it is the word healing. So even though we have all that other stuff going on, healing is always at the center of everything we do. But all around it are kind of the multiple layers of consciousness, personal and group dynamics. It shows the tangible and the intangible areas of all of our interactions. And so, we don't get a ton of training on this in regular nursing school, I don't feel like. But when we bring this deeper level of awareness into everything we do, it just makes us better nurses, and it helps us to even recognize some of the biases and the things that we bring into every interaction that we have. We start to realize these more subtle things about ourselves, and we can connect more deeply with people. So, healing with psychedelics, we'll hit on this a little bit. The 7 factors over here at the side, I just think it's a really concise, nice chart that preparation, what these are the things that affect a psychedelic experience, excuse me. But preparation, what it is, the dose, how it's consumed, the setting, and then, like we've already been talking about, the integration can't be overstated. So, for those who aren't familiar, set just kind of means the preparatory mindset. So, nurse coaches, especially, we're really trying to foster, hope, optimism, trust, self efficacy, intention, all of these things that are, super big importance when you're going into a journey. Being able to trust and being able to be open to whatever it brings you is huge. They always say you don't always get what you want, but you always get what you need. And so I think that's a really good mindset to have. Setting, so set and setting is really just the physical environment that somebody's in for an experience. So nurses are already, masters of making healing environments. I feel like with special training, we could really help facilitate making a space for radical healing and growth during a journey. And this can help dispel, a proper environment can help dispel the challenge that might come when an environment isn't so hospitable, or there's distractions or things going on, and then a challenging or a difficult experience happens for somebody. If we're taking the time to do set and setting prior to an experience, it makes a world of difference. Um, so once again, the most work comes after the experience. We as nurses can actually use this window of neuroplasticity and this window of opportunity, not just to work on integration in the typical sense, but also maybe use it to make life-serving habits in, our medical training sense. How's your sleep hygiene? Maybe we can work on that too. How's your stress management? Just things that maybe our nurse training could also add on top of this work. So, what is psychedelic integration anyway? So, integration is really just the process of figuring out what are the messages or lessons and takeaways that I got from the experience, and how can I apply these into my daily life. And I kind of showed pictures there of some journaling, music therapy, somebody doing meditation. These are all really common ways to do integration, but it's highly individual. So, we need to remember that everybody's different. Not everybody's going to want to do the same thing. And we always have to remember that the healing is coming from within them. It's not coming from us directly. We're partners, we're space holders, we're enthusiastic supporters, but ultimately they are the ones doing their own healing. So we want the psychedelic experience and the lessons that are learned to be integrated into the everyday life and useful, and it's going to integrate no matter what after enough time has gone by, but we don't want it to become something that happened outside the self if we don't do any work with it afterwards, or something that you later chalk up and go, oh, that was a crazy time. That was just a hallucination drug experience. We want to take these insights and really gain something from them. So I just wanted to show here kind of some of the correlations. So on the left are some interventions most frequently used in integrative nurse coaching sessions, and then some common psychedelic integration practices. And you can see tons of them are exactly the same. That I feel like we just have so many common modalities and things that are in alignment that I think nurse coaches are really in a great place to help people with this kind of work. And you don't have to be actively involved with anything involving substances. There's still people that go to retreats, and do things different ways and still need somebody to talk to and to help them integrate after their experience. So just a little sheet on quantum change, because I just think it's such a cool concept. So William Miller, he's actually the founder of motivational interviewing, which is a coaching concept, spent a lot of his life researching mystical experiences and quantum change. So quantum change is a sudden and often permanent transformation after a highly memorable experience. And I myself had a quantum change when I was about 19 years old. I remember I was in my first apartment, I was watching TV, and this commercial came on, and there was a little veal calf in a crate. And its leg kind of buckled and it fell. And it struck me like a bolt of lightning. And I went, I'm never eating meat again. And literally, I was 19 years old. I'm 35 now. I've never eaten meat again. It was one of those quantum, as soon as I got this piece of information, like everything changed. I knew there was a new truth about me. And I think a lot of people have probably had quantum change experiences. Sometimes you have to sit and reflect on what those might have been. So psychedelics bring forth a potential for rapid change and even these type of quantum changes. Research has shown that mystical experiences, which are often brought about by psychedelics, are good catalysts for this type of dramatic change. So looking at studies even 20 years later, a majority of people who've had a quantum change will still vividly recall when it was and what it felt like and, smells and everything about it. And they will relay that they are still changed by whatever happened so long ago. This picture on the right hand side is the mystical experience questionnaire, which I think is really cool because it's so hard to quantify what a mystical experience really is, but here you go, here's our Western medicine way of really quantifying that. And they've used this in a lot of psychedelic studies. They've used this one for the St. Johns Hopkins psilocybin studies to help kind of tell who's had true mystical experiences and who didn't. I just think it's a cool thing to know about. So, psychedelic nursing resources. So, we've got here on the left the International Association of Psychedelic Nurses, which I'll touch on just a little more in depth. Then we've got Open Nurses, which is the Organization of Psychedelic and Entheogenic Nurses. And they have a really active Facebook group. So, whoever's interested that's, into nursing and psychedelics, I highly recommend going on Facebook and joining their group. And then you've got the California Institute of Integral Studies, and they're kind of the most recognized right now and credible for a certification program for psychedelic assisted therapy. They have 2 cohorts that are chosen annually, and they currently have 3 nurses on staff that are part of the teaching for it. Over here is just a little more information about International Association of Psychedelic Nurses. It was made last year, founded by Taylor Hayes. Our mission is to promote increased global awareness and education on the topic of psychedelic medicines and to utilize latest research in developing safe standards of nursing practice. So that is huge. Down at the bottom, you can see the Hope Network Psychedelic Health logo. So that is where the actual training happens. So there's a location in Jamaica and there's a location in Brazil. This year they're doing Jamaica, and like I said, it's for medical psilocybin and cannabis training. I will be participating. I'm really excited about it, but they're going to intend to offer quite a few wellness courses and trainings. So keep your eye out if you're actually interested in doing some hands-on training. There is a website, so look them up and they will notify you of when the next training will be. Here is a psychedelic code of ethics that Open Nurses has come up with. So this is just a Cliff Notes version. There's a much more detailed version on their website. So I highly recommend, if this is something that you're interested in, to go take a look. But they're advocating for just central involvement of nurses in creating psychedelic policy, culture, education, and research. Like I talked about earlier with people trying to get patents on really strange things, I think it's just important that nurses start to get involved, you know, even just from an ethical standpoint. So, some of the highlights here: honoring ancestral traditions, adherence to law, safety, appropriate training. And then down at the bottom, really important: accountability, equity, and access. So, I highly recommend taking a look at their code of ethics if you're interested. And then, since we're talking about ethics, I think this one is really cool too for nurses to take a look at. It's called the North Star Ethics Pledge. So, North Star is a really cool project that was put together to try to establish ethics, respect, and ecological justice when the inevitable world of business starts to enter the psychedelic realm. You know, we kind of have learned a few lessons about the cannabis space as big business has gone in there, and it probably won't be too long before we have to worry about these sort of things. So even though we may not see ourselves as involved in the business, nurses could definitely benefit from reading this pledge, and signing it. You can go online, you can sign their ethics pledge, and you can even add your own annotation or your own pledge to it when you sign it, which I think is really cool. And so here are the principles on the right side. And I've obviously made these Cliff Note versions too. But number one, starting within and treating personal growth as a lifelong process, studying traditions. So obviously respecting indigenous people and cultures, building trust in the community, focusing on the process just as much as the outcome when we're working with clients, creating a space of equality and justice, and then paying it forward, that if we're rewarded in this space and we become successful, that we're giving back to the community and all the others who are in it. I think that's really important. So nurses, and this goes all the way back to Florence Nightingale, we've always been involved in social justice movements and making sure that care is equal across the board. So these are by no account all of the movements going on, but I think these are some of my personal favorites and the biggest ones. So decriminalize nature, we kind of talked about. They're really helping cities to decriminalize entheogenic plants, and they will help people come up with documents to bring to city council, which is really cool. They already have drafts of everything. Down there on the bottom left is Shaprona, which is combining indigenous wisdom with Western research. And they're also advocating for ecological rights too, of people that are protecting areas where these substances are found. So I think that's another really important one. And they actually have a conference coming up in April. I believe it's called the Plant Spirit conference. So if you have a chance to go, it's in mid-April, it's online. Take a look. The Last Prisoner Project is a little more cannabis oriented, but I love them. Their mission is to get every last cannabis prisoner out, and they will not stop until everybody's out. If we're talking about federally legalizing cannabis this year, then absolutely nobody should be left in jail when something like that is happening. When you look at the far right, we've got the Heroic Hearts Project. So they are giving or providing ayahuasca retreats for veterans for PTSD. So great cause there too. And then Thank You Plant Medicine gets its own little page here at the end because it's coming up. On February 20th, there is a movement called Thank You Plant Medicine, and they invite you to use the hashtag Thank You Plant Medicine and kind of come out with your plant medicine story. And help to raise awareness, end the stigma. So every February 20th, I'll be doing it. Please join us if you feel compelled to, and if you have an experience. Yeah, I think it's a great cause. So I know this is another little overwhelming here, but we're almost at the end. So I just wanted to say nurses also have a big role in harm reduction when it comes to, psychoactive substances. So we're all probably familiar with non-malfeasance or do no harm. It's the most well-known ethic in all of nursing. So harm reduction is really just a movement for social justice built on the belief and respect for the rights of people who happen to have used drugs. So it establishes quality of life and well-being, and doesn't just take cessation of drug use as the criteria for success in whatever we're doing. So we're trying to ensure that people who have used drugs have say in policies that are being made to serve them. That infographic on the right hand side is by the Zendo Project, which originally I believe started at Burning Man. And it's kind of their concepts of how to transform what might be a difficult or challenging psychedelic experience into a transformative one or an opportunity for growth. So you can see a lot of the concepts on there: be open, trust, presence. They train a lot of people, and I know I have a little thing about the Zendo project there at the bottom, but they train people to be these supportive peer supporters at Burning Man, at festivals, at a lot of places in person. They have great harm reduction education that's available. And they're just really all about proving that experiences can be transformed. And even if they're difficult, that there are always opportunities for growth. Dance Safe is another great one. They are on site, but they also order or offer testing kits that you can get on site when they're at festivals or at raves, and you can order them online. And they have a lot of really good, for lack of a better word, like layman's educational materials on a lot of substances. So they're great for people that might not necessarily know a lot about substances, for them to get educated on, harm reduction, safety, and what substances actually are. I love this page because I'm a book nerd and I've read all of these, and they're all available on Audible too. So if anybody's, better with audiobooks than with actually reading, they are available. So these are some nursing aligned psychedelic books that I like. My favorite is Consciousness Medicine. It's there on the far left. I think that's the most nursing aligned one. It was written by, and I hope I don't butcher her name because it's French, it's Francois Brzant. I am not the best at saying that, but she is trained in somatic psychotherapy, and then also worked with the Mazatec people in Mexico in their mushroom ceremonies for quite some time. And she takes both of these concepts and has come up with just a beautiful, holistic intake tool. Has just a wonderful guide on working with people before, during, and after all sorts of mind expanding experiences. So, like sweat lodges, obviously psychedelics, breath work, all sorts of experiences that can bring you to that same place. How to Change Your Mind. A lot of people probably have read it, but it's still a great book written by Michael Pollan. It's a little more sciency and a little more on the history of psychedelics. So if people are a little less spiritual, a little more sciency, that's a great book. DMT, the spirit molecule. I love that book because it goes into great detail of experiences. All of these subjects in the DMT trials were in a hospital. So there were a lot of challenging experiences. And I think it really proves the impact of set and setting when we're talking about these powerful medicines. And then the Psychedelic Explorer's Guide over there, James Fadiman, he's kind of the godfather of modern microdosing. And it's a really great book that just shows psychedelic therapy guidelines as well. So we're on the second to last page here. I just wanted to show some of the biggies in the current research institutions. So this is by no means all of them, but I just wanted to highlight here. So MAPS is the OG. Rick Doblin back in the 80s developed MAPS, and we really have them to thank with how far we've come today, especially with MDMA or MDMA and with psilocybin. Over at the top left, you've got Johns Hopkins, and they had a landmark psilocybin study in 2006 that really started the ball rolling in this renaissance that we're having right now. And they're doing some really interesting new studies looking at psilocybin for opioid addiction, for Alzheimer's disease, for PTSD, and even for Lyme disease and anorexia. So a lot of new uses that we haven't really seen a lot of studies on yet. So that's interesting. Hefter Institute actually doesn't do research, but they fund research, which I think is a really notable job. You can't patent a naturally occurring product, so that's why a lot of psychedelic research doesn't happen. There's not a lot of money to be made. They're stepping up. I also want to mention down there in the corner, the Berkeley University of California. That's the newest one up here. And Michael Pollan, who wrote How to Change Your Mind, is actually one of the founders. They got a 1.25 million anonymous donation to start this institute, and they're really looking at more neuroplasticity and the betterment of well people in the realm of psychedelics, which a lot of people have not dared to touch yet. So I think that's really interesting. And they're actually coming up with a program to train psychedelic guides. So I'll be watching that very intently, and I'm sure a lot of people will be. And then moving to our very last slide here, I just want to say thank you for everybody who was here with me for this, and my man Robert Plant wearing the Nurses Do It Better shirt just to finish us off. But that's really it. I'm kind of, welcoming questions or comments. I might not have all the answers, but I am open.
Thank you so much, Devin. That was,
Yeah.
I really appreciate all of the wisdom and time and care and thought that you put into this sharing. I feel really inspired and educated. Like I've been exploring this realm for a while, but you really like succinctly described everything. I think for someone who's new to psychedelics and plant medicine, and for those of us who are interested in going deeper into it, like it's a really beautiful, thorough exploration of what's going on, and I really appreciate you for sharing with us. Thank you so much.
Yeah. Oh, I really appreciate you having me here. Thank you so
Yeah,
much. It was a delight to share
yeah,
anytime.
cool. And it's so cool to see nurses and nurse coaching like getting more into this space and bridging these two worlds together. It's really,
Hmm.
really inspires me. So thank you for sharing that as well. And yeah, I just read Consciousness Medicine actually. It's a
Oh,
beautiful.
yeah.
Yeah, I've been using it. I do breath work. I facilitate breath work, holotropic breath work with in the Stan Groff lineage you mentioned at the beginning. And I found
Hmm.
like, yeah, that book to be really spot on. And yeah, there's so much that we can do in this space as nurses and
Hmm.
exploring consciousness through different modalities. So it's great to see what you're doing. It's really inspiring. Um,
Thank you.
doing. Yeah, thank you. And we'll be sharing, for those of you who signed on live, people have been popping in and out. I don't have questions from anyone, but if anyone has questions that come up later, you can always type into the Mindful Nurses Facebook group and start a discussion on anything. I think I'll start a discussion on the Thank You Plant Medicine. What is that, like a day that you
Yeah.
mentioned? Like, yeah, maybe in our group, just to start a discussion around that, to see like what nurses in our community have to say about their experiences with plant medicine, and all of us to just share our experiences. I loved what you said at the beginning about nurses being one of the more trusted professions. And I think the more that society, communities see nurses engaging with plant medicines and our own stories of plant
Hmm.
medicine, really valuable for us to share our experiences with it, to build
Absolutely.
credibility in this field.
Hmm.
So
Absolutely.
yeah, yeah. So thanks again, and yeah. So we'll be sharing the presentation. We'll be sharing Devon's contact information for anyone who wants to reach out to you personally for more information. Um, and yeah, thank you everyone for tuning in. Stay tuned. Next week we have an exercise, fitness class. So we're always doing different things, sometimes talks, sometimes practices, but every Wednesday we're coming together for some kind of event. So next week we have an exercise class with a beautiful nurse who's sharing on that. And yeah, stay tuned. And thank you again, Devon, for sharing with us today. I really appreciated this session. Thanks so much.
Anytime. And yeah, anybody who wants to reach out, I'm totally open and here to support you. So please do if you feel compelled. I would love to hear from you.
Thank you.
Thanks.
All right. Have a good evening. Thank
You
you.
too. Yeah. Let's see. Let me try and get out of my Zoom here.